Hello everyone, my name is Christy Kuna and I am the Vice President of Programs and Operations at the OAC, one of the founding champions of Obesity Care Week. And today is day 3 of Obesity Care Week and we are recognizing Obesity Prevention and Treatment Day. The treatment of obesity is not as simple as eat less and move more. Obesity is a lifelong disease needing comprehensive lifelong health care. That is why today is all about raising awareness of prevention and treatment options and how to find an obesity medicine specialist to help you in your journey with obesity. So first, we want to hear from someone who could help us look at prevention and treatment from a medical expert's perspective. So I am proud to introduce Dr. Scott Kahan. Dr. Kahan is an obesity medicine specialist and the director of the National Center for Weight and Wellness. He also happens to serve on the national board along with multiple committees. Let's welcome Dr. Scott Kahan.
Hi, my name is Scott Kahan, and I'm excited to talk to you for a few moments as part of Obesity Care Week. I'm a physician specializing in obesity medicine and preventive medicine, and the primary area that I work in with patients is with respect to weight management, obesity treatment, and obesity prevention as a goal in part of improving a whole range of areas of health, like preventing diabetes and improving cholesterol and improving quality of life, so people can feel good and live their lives. It's unfortunate that there's such misunderstandings around obesity and obesity treatment in our society. Much of this is driven, unfortunately, by weight stigma. But advances like Obesity Care Week and a lot of work that's being done, I think, have the opportunity to move things forward. And that's one of the reasons I'm so excited to talk to you today. Obesity is a real health problem. It's important we all recognize that. It's no different in that sense from diabetes or hypertension or heart disease. And for each of these, there's a spectrum of prevention and treatment tools that are important. Now, of course, when possible, prevention is best. Unfortunately, our society all but pushes us to eat more and eat unhealthier, to move less, to stress more, and to sleep less. And all of these increase the risk for weight gain, obesity, diabetes, and lots of other health problems. So, on the one hand, we want to change parts of our society that predisposes to so much unhealthy foods being available, the processed foods that are engineered to be so tasty and so cheap. They're marketed all over the place. And on the other hand, healthier foods are much harder to come by. They're typically more expensive. In our society, typically physical activity is hard to do when you're having to sit in front of a computer or a desk for 8-9 hours a day. You have to drive or take transportation to work, to and from work, at least before coronavirus. It doesn't leave a whole lot of time available for much activity during the day. So many of these reasons set the stage for weight gain and obesity, diabetes, and such. And there are preventive things that need to be done to minimize that effect on us. But then when people have obesity, it's important that we have treatment options available. Of course, for some people, learning about nutrition, learning about physical activity, maybe getting a trainer or something like that, that may be enough and good for them. But for many, many others, it's not enough. And sometimes good scientific treatments may be needed. That can include counseling, it can include medications, it can include surgery in some cases, and we have lots of these scientific treatments. So it's important that people know that good treatments are available. It's important that doctors know about the treatments so that patients can get the help that they need. It's important that policymakers recognize obesity as a real health condition so that these treatments are covered and people have access to them. So I hope that everyone listening to this has some participation in the Obesity Care Week, and with all the work that we're doing together, I hope that we can move the needle on this so that everyone gets the help they need, the support they need, and the treatments they need. So good luck to everyone. Stay safe, stay warm, and good luck with everything.
Dr. Kahan gave a great overview of the obesity treatment and prevention landscape. So now we want to hear from a patient, someone who has tried various forms of obesity treatment, to share their own perspectives on this topic. So I'm happy to introduce Amber Hewitt Garcia. Amber happens to be a former OAC chairwoman, and she's a current national board member. She's a committee volunteer, but most importantly, she is a passionate patient advocate. Let's hear from Amber.
Hi, my name is Amber Hewitt Garcia, and I have tried various forms of obesity treatment over my life. So I was 101 pounds in kindergarten. I came from a long line of generational obesity. We certainly went on diets as a family. We went to dietitians. We all went low carb for years. Enrolled in programs where we weighed in public, and none of those things there were moments of success, but really no one in my family had ever meaningfully reduced their weight long term. And so I had bariatric surgery at 23 years old, and so I get asked the question a lot, was there like this moment where did something break, or you get embarrassed, or there was just this, you can point to that moment in time where you knew that was what you were going to do. And I genuinely, there may be a group of moments, but for me it was watching my family and understanding that it was serious, and just this haunting in the back of my mind when you know something is wrong, or in your heart, that I wasn't going to live a long, full life, that I wasn't going to have an active life, that I was going to let life happen to me. And that scared me. And I lost about 180 pounds through bariatric surgery in 2009. A lot happened in between, including some pregnancies and crazy careers, and running for office. And I didn't regain even half of what I lost, but enough where sort of those reduction tactics were not working. And so I was revised in 2019 to a modified duodenal switch loop. And now I'm at the lowest body weight I've ever had. I actually have a BMI in the overweight range for the first time in my life. I am where I want to be in terms of weight, and have pretty significant excess skin that I am having removed this year too, which is a big moment for me. But for me, being involved in advocacy work over the years, and being somebody who has sought treatment and experienced success, or achieved the body weight that, my ideal weight that I can both maintain and be happy at, is that I have always known, but have become vocal, that obesity is a lifelong chronic relapsing disease. I do not see myself as an after photo. I do not believe that I'm cured. I believe that I do have obesity, and I always will. And the science tells us that that's true. This is a moment in time that my care is working for me. So over the years, I've tried lots of pharmacotherapy, and experienced some success with it. But it has always been in addition to surgical intervention for me personally. But because I've experienced success in weight loss, I get a lot of phone calls. People asking me about bariatric surgery, or what do you know? What should I ask my doctor? I would say at least every other week. Sometimes family, sometimes friends, sometimes literally people I do not know cold call me because their friend told them that they knew that I'd done well and wanted to talk to someone. And the message that I always share beyond obesity being a lifelong chronic relapsing disease is that you have to think about treatment in terms of a spectrum. It's not one. And if one doesn't work, that doesn't mean you're a failure. It's about many and trying different approaches and finding a medical team that supports you. And that includes taking care of your mental health. So don't be discouraged. There's not a single person where one intervention works for all of us, or if there were, somebody would be making some money off of this. We have not cracked the code, so to speak. And so don't feel like you are a failure. You're an individual with a chronic disease who has not yet received the right treatment for you. And to go easy on yourself. Because it's a marathon, not a sprint. So I hope everyone, my greatest hope for obesity care is that we not only as individuals affected by obesity believe that we're worthy of care, but we're treated with respect and dignity that we deserve from medical professionals. We got a long road ahead of us.
Those two perspectives really rounded out today's look at obesity prevention and treatment. And don't forget, the OAC has resources on this topic. First, we have the Obesity Care Providers Locator located at obesitycareproviders.com. This is a great place to find a qualified medical professional to talk about your weight and health. We also have our popular Understanding Your Weight Loss Options brochure. In this brochure, you'll find all of the options for weight loss and lots of great information to help you in your journey. And then we also have more education beyond this. We have Weight Matters magazine, brochures, and guides. So visit OAC's website at obesityaction.org to check out all this great information. And all of OAC's education is available for free, so it's free of charge. So we would hope that you would support this effort by making a tax-deductible donation. You can easily do this by visiting obesityaction.org/donate to make your contribution today. And we have to thank our Obesity Care Week 2021 partners, who this would not be possible without. We have Novo Nordisk, Medtronic, Ethicon, Eli Lilly, Bariatric Advantage, Boehringer Ingelheim, Celebrate, Curax, and Hitachi. And also great big thanks to our OCW2021 champions. And so you'll want to stay tuned for tomorrow, because tomorrow's Focus Day is all about access to care. So you won't want to miss out on all the fun tomorrow. But for now, we'll say goodbye, and we'll see you tomorrow for Access to Care Day.